Welcome to the 5th module in the Surviving and Thriving as a New Leader series. We hope that since the last module, you've had some time to practice your listening skills, learned a bit more about your preferred conflict style, and have had a chance to practice getting more comfortable with conflict and difficult conversations. In this module, we're going to dive into the topic of change. We'll talk about common experiences that people have through the course of change. We'll talk about specific things you can do as a leader of change to smooth the process and help others through the transition, and help yourself as well. Just like last month, you'll hear other hospital leaders and experts share their perspectives on these topics, and we'll leave you with a few things to explore and pay attention to between now and the next module. So let's dive in. Change is part of all of our lives, but if you work in healthcare, you're part of more changes than many others. The speed of change is increasing all the time, and because the transition to value carries with it even more uncertainty than most changes, it's even more critical for those leading the charge to be especially skilled in change leadership.
To be a highly skilled leader at Tri-County, first and foremost, you have to make sure that you seek clarity on what we're trying to accomplish. If there is not clarity and a unanimous understanding and approach to what we're doing, we obviously end up sending mixed signals to people. So that's one of the big things that we do. Transparency is another key for the way that we operate here at Tri-County to help make sure that everybody understands the why behind what we're doing. It's very easy to tell people what to do and maybe even how to do it, but until they truly understand the why, they can't necessarily do it in the best way possible. We are looking for people to bring ingenuity, their own creativity, their own intelligence to the table as we look to do that work.
The most effective change leaders take a proactive approach to change. They pay attention to what's going on inside and outside the hospital that may require a new way of doing things. They serve as a role model for others by responding to the ever-changing environment in a thoughtful, intentional way. They advocate for their employees and influence those above them in the organization when a planned change isn't working as intended. You probably remember that there were 6 leadership styles represented in the leadership style assessment you completed earlier in this series. Of these 6 styles, the 2 that are most relevant for leading change are a visionary style, where the leader mobilizes their team toward a compelling vision of the future. In the case of change, this means painting a clear picture of the purpose of the change and what things will look like in the new environment. And a democratic style, where the leader gets input from their team and works collaboratively with them. This promotes buy-in from the team and ultimately results in more successful, longer-lasting change because multiple perspectives were represented throughout the change process. As we proceed through this module, we encourage you to think about ways that you might use these 2 styles. What would it look like to use visionary and democratic leadership styles during a change process with your team? If you have trouble answering this question, no worries. Check out the resource guide for this series. Let's take a minute to look at the process of change itself. Decades ago, social scientist and physicist Kurt Lewin developed a way of looking at change that is still used widely today. Lewin looked at the process of change in 3 steps: unfreezing, changing, and refreezing. Unfreezing involves helping others to understand the need for change and challenging the status quo. The goal is to shake up people's perceptions of how things have been done and see what the future could hold. Unfreezing sets the stage for the change itself to take place, where people start to behave in ways that are aligned with the new direction. And lastly, refreezing involves making permanent any changes to workflows, policies, reward systems, and other processes to ensure that they support the desired change and minimize the odds of reverting back to the old way of doing things. Here's an example related to the transition to value. Imagine that a healthcare organization has decided to incorporate behavioral health screenings into primary care visits to more fully address whole person care. Unfreezing might involve bringing together all providers and staff who would be affected by this change. There would likely be some education so that all parties understand why this new way of doing things is being proposed. Questions about workflow, needed resources, and staffing would be addressed collaboratively with input from across the group. Then the change would take place. Providers would begin screening patients and making referrals when warranted. Then, after some lessons are learned about what works and what doesn't work, refreezing would happen. Provider pay practices, billing, referral workflows, and other processes that support this change will be finalized. If this sounds simplistic, it is. Change is almost always much more complex than this. But if you lead a change initiative keeping this three-part model in mind, it can help you stay aware of where things stand in the big picture view. Many change management experts make an important distinction when it comes to change versus transition. They define change as the events that take place and the steps involved in getting from here to there. Things like planning the initiative, identifying milestones, and preventing roadblocks. There's no doubt that leaders are responsible for making all of this happen. But the other aspect of all this is transition, the inner experiences each of us has while going through a change process. Things like excitement, uncertainty, fear, or frustration. Leaders are also responsible for helping others with their inner experiences or transitions and managing their own emotions as well. For many of us, managing change can be much more straightforward than managing transition. And that transition piece is what we're here to help you with. Let's look for a minute at the emotions people often experience over the course of a change. This curve may look familiar to you. It follows the consecutive stages of grief identified by Dr. Elizabeth Kubler-Ross in the 1960s. A body of research conducted since then supports the idea that this same pattern shows up in the emotions we experience during change. The stages are denial, shock, feeling overwhelmed, feeling that it may not affect me or may not happen at all, anger, underlying pain that sometimes comes out in negative ways toward others, bargaining, which is all about negotiation, depression, feeling empty. We're not talking about clinical depression here, just a feeling of emptiness specifically in the context of the change, and acceptance of the changed reality with a sense that the new reality is permanent. In the real world, this process isn't always quite this neat or well-defined, and studies have found that we can move backwards on this curve as well, not just forward. As you're going through a change, however, and supporting yourself and others as things progress, it can be helpful to remember that change actually often involves grief, letting go of the past and accepting a new reality. Even when a change is positive, there's still a process of letting go of the past and adjusting to a new reality.
Usually you say, okay, I can get this change done in 6 months. You have somebody that's really adamant about not wanting to change, it may take you 6 months to get them convinced that that change needs to occur. So then you've got 6 more months to make the change. So be willing to be flexible and extend that. I've had, I think, 2 instances the entire time I've been in a leadership position where I just had to tell the person, I tried working them through and they said, no, we're not going to do this. And I said, okay, we are going to do this. And this is how it's going to work. And I'm going to help you. And in the end, they came back and thanked me. But there have been only those 2 times. So rarely are you ever going to say, yeah, we're going to have to do this. I understand your position. I understand what you want. I do realize change is very, very hard for you, but we're going to have to do this. And they accepted it, worked through it. And both times that person came back to me and said, thank you. You know, I don't like change. And, I really it's hard for me to accept change. I said, yeah, I understand, but it worked out really well.
So given all this, what can you do as a leader to help others adjust to a new reality and move along the change curve? Noel Tishy, a faculty member at the Ross School of Business at the University of Michigan, developed a way of classifying the types of impact that a change can have on a given person. Several researchers have built on Tishy's classification since then, and it's become a valuable tool for helping others through the process of change. Let's go back to our example of integrating behavioral health screening into primary care. Imagine that the proposed change is for primary care providers to conduct screenings and then refer patients to other providers for behavioral health support. Let's think a little bit about the impact this would have on a primary care provider, a nurse, or a medical assistant new to these screenings, and possibly new to the field of behavioral health in general. When they first hear about the proposed change, they might wonder about the technical aspects. Do I know enough about behavioral health to do this justice? Do I have the time to fit this in with the other things I have to do? Is this just one more thing I'm going to have to do hundreds of clicks in order to get done? They might think about the political aspect, their own power and influence. A provider might wonder if doing this type of screening means they no longer have control over any behavioral health-related discussions with the patient. Or if there's someone who has a lot of experience in behavioral health but had no input on the screening form, their lack of input into the process might be another politically based source of frustration for them. They might also think about the cultural aspect. How does this process connect with their values? If their long-held mindset is that behavioral health and physical health are two separate things that need to be addressed separately, this new process goes against that mindset. If, on the other hand, an integrated approach fits with their view, they might have an easier time with it. If someone is stuck in one of the early stages of the change curve, like denial or anger, it can be helpful to use this framework to think through potential areas of concern for this person. Are they angry because of a technical concern, political concern, or cultural concern? There are specific things that you can do as a leader to address it, depending on the source of the concern. See the resource guide associated with this series for more information and for a worksheet to help you identify the source. The tricky part of all of this is that different members of your team can be on different parts of the change curve at the same time and have different sources of concern. If you've led a team through a challenging change before, you've likely experienced the need to change your approach frequently in order to meet the needs of different members of your team. There's no formula for getting this right. Some days you'll feel good about leading a change, and other days it might feel like you can't do anything right. You're not alone. Every leader has felt this way. If you can work to keep your eye on the future using a visionary leadership style, as well as a democratic style focused on inclusivity and collaboration, your odds of successfully making it to the other end of a change initiative increase significantly.
Change can be uncomfortable for people, but I think that change is the inflection point at which you've decided we don't want to continue to do things this way. We want to do it another way. So use change as an opportunity to stop and assess where you want to be, what your ultimate goal is. And as leaders, if you're making changes to the organization because you see the need for the change, it's a great time to stop and say, what else can we be doing? How do we want to incorporate so that it's a part of our organization, that diversity, that inclusivity, that equity? How do we want to really embed that into the organization? And change is the perfect opportunity to do that. You've decided something's not working for us. Let's make a change. But while we're making that change, we have recognized that we have an obligation, not only internally, but externally, to have diversity in the people that work in our organization, that we express that diversity so that the people coming into the organization for care see people that look like them, and that we want to demonstrate inclusivity. So change is the perfect inflection point for that.
Before we end this module, let's take a few minutes to talk about managing our own emotions during the change process. When you're leading a change, not only are you responsible for paying attention to the transition experiences of other people, but also for your own. Going back to leadership styles, leading change and transition requires using visionary and democratic leadership styles. It means sharing a compelling vision of the future and listening to others' concerns without venting your own frustrations to them, while still supporting your own well-being through the transition. We'll share a few tips to help you do this, and then we'll hear some more helpful ideas from our interviewees. The first thing you can do is to recognize when you're feeling frustrated or de-energized, and recognize it without judging yourself. Then, take a minute to think about where you might be on the change curve. Feeling demoralized, for example, might mean you're in the dip of depression on the curve. Then, think about the source of your feelings. Is it technical, where you just don't have the time, knowledge, or resources to move forward? Is it political, where you just don't have the power to impact your environment in the way you'd like? Or is it cultural, where what you're experiencing is conflicting with your personal values? If you can identify the source, you can use the same strategies with yourself as you would with someone else. See the reflection and planning worksheet in the resource guide for this series for more information.
Change is inevitable. People say either you're moving forward or standing still. Nah. Either you're moving forward or you're moving back, because everybody else is moving. So as they're moving forward, then you're going back, whether you're standing still or not. So change in order to meet goals are inevitable. Some people have a very hard line in relation to this is the way it's done, this is the way it's always been done, it's easier this way, and we don't want to change it. As a leader, you have to be able to look at everything, all the corners in the box, all the inside of the box, and what's outside of the box.
Wow, leading change is a big topic, and we've covered a lot in this module. In our next and last module in this series, we'll take a look at engaging your team, what you can do to foster passion and commitment in your team. Between now and the next module, we encourage you to reflect on these questions on your own or discuss them with your colleagues to help you think through how the information covered in this module applies to you and your organization. What kinds of changes are you currently experiencing or leading? What examples of unfreezing, changing, or refreezing have you seen in these changes? How are these change initiatives going? If they're going well, why? If they're not going so well, why aren't they? Think of one specific change initiative you're currently leading or have led in the past, and identify one person who resisted that change. Where did they get stuck on the change curve? Would you classify the source of their resistance as technical, political, or cultural? Think of one specific change initiative you're currently experiencing. Where are you on the change curve? If you're a bit stuck, is it due primarily to technical, political, or cultural factors? And how can you address these challenges? And here are some things you might consider doing to further develop your understanding of the topics in this module. Talk to your direct supervisor about current or upcoming change initiatives. Find out what they most expect from you during the course of this change, and share with them what you need most from them in order to meet these expectations. Find out what changes they're working on that are particularly difficult. Ask what their biggest challenges are, how they're working to address them, and what they've learned from the experience so far. Use the planning and reflection worksheet in the resource guide to develop strategies for addressing technical, political, or cultural concerns that someone on your team might have about a current or upcoming change. Listen to one or more episodes of the Center's podcast, Managing from the Middle, Leading Through Change. For additional information and resources on any of the topics covered in this module, see the resource guide that accompanies this program by searching for Leadership Fundamentals within the Center's resource library. And of course, please feel free to contact us at the Center anytime for additional support. We thank you for joining us today, and we look forward to continuing the conversation over the next few months.